Do you sometimes forget simple things like where you left your keys or why you walked into a room? If you're over 60, you're not alone, but it's important to recognize when memory loss is more than just aging. In today's video, we'll explore the early warning signs of memory loss, the key causes of dementia, and what science says about preventing Alzheimer's. Let us take care of our brains as we age, because healthy aging starts with awareness and action. 2. Early signs of memory decline. These symptoms are often ignored, but they are the brain's way of warning us early. 1. Forgetting recent events or conversations, for example, forgetting what you had for lunch or misplacing your keys moments after using them. This is often the very first and most noticeable symptom in the early stages of memory loss. 2. Difficulty planning or completing familiar tasks, for example, struggling to pay bills or forgetting how to cook a dish you've made many times. According to the Alzheimer's Association, this happens due to a decline in the brain's ability to organize and sequence information. 3. Language problems. Trouble finding the right words, repeating things, or stopping mid-sentence. Example, forgetting basic words like table or phone during a conversation. 4. Getting lost in familiar places, difficulty finding your way home or recognizing streets you've walked for years. This is a hallmark sign of early Alzheimer's, often tied to damage in the brain's hippocampus, responsible for spatial navigation. 5. Sudden mood and personality changes. A usually calm person may become irritable, depressed, or suspicious of loved ones. These changes are linked to chemical imbalances and nerve damage in the brain. Reminder: having one or two of these symptoms doesn't always mean dementia, but when they become frequent and disrupt daily life, it's important to seek medical advice from a neurologist. 3. Common causes of dementia. Dementia is not a normal part of aging. Build-up of amyloid plaques and tau tangles in the brain. These are the most well-known medical and lifestyle-related causes. 1. These protein deposits block communication between brain cells and trigger nerve death. According to the Alzheimer's Association, this is the primary cause of Alzheimer's disease, which accounts for 60 to 80% of all dementia cases. 2. Poor blood circulation to the brain. Conditions like high blood pressure, diabetes, and high cholesterol damage brain vessels, leading to reduced oxygen flow and neuron death. Mayo Clinic highlights that cardiovascular health is directly linked to vascular dementia, the second most common type. 3. Lack of mental stimulation. Not reading, learning, socializing, or engaging the brain regularly leads to less neural activity and weaker connections. Harvard Health notes that mental stimulation, like puzzles, learning new skills, or social engagement, can delay cognitive decline. 4. Poor sleep habits. Sleeping fewer than 6 hours per night affects the brain's ability to clear waste, including harmful amyloid proteins. Harvard Medical School recommends 7 to 8 hours of quality sleep per night for adults over 60 to reduce dementia risk. 5. Poor nutrition. Low intake of omega-3 salt found in salmon, flaxseeds, vitamin B12, and folate. High sugar and saturated fats increase chronic inflammation, which damages brain cells. The National Institutes of Health found that people following the MIND diet had 15 to 25% better memory function compared to those with poor diets. 6. Loneliness and chronic depression. Elderly people who are isolated and lack social interaction have twice the risk of developing dementia. Yale University studies show that social connection is just as vital as diet and exercise for brain health. Part 4. 5 science-backed ways to prevent memory decline after 60. These evidence-based habits can help protect your brain and reduce your risk of dementia. According to top medical institutions: 1. Walk at least 30 minutes a day. Walking increases blood flow to the brain, improves mood, and boosts memory. A study published in Neurology found that adults who walked regularly had a 40% low risk of developing dementia. Tip: aim for brisk walking or walking in nature for added mental health benefits. 2. Eat the Mind Diet Mediterranean intervention for neurodegenerative delay. Focus on green, leafy vegetables, berries, fish, nuts, olive oil, and whole grains. Avoid red meat, butter, cheese, and processed foods. Research from Rush University Medical Center showed that the Mind Diet can lower Alzheimer's risk by up to 53% when followed strictly. 3. Get 7 to 8 hours of quality sleep. During deep sleep, the brain clears harmful toxins that can lead to dementia. Harvard Health suggests keeping a regular sleep schedule and limiting screens at night. Tip: avoid caffeine in the afternoon and create a dark, quiet bedroom. 4. Keep your brain active. Try crosswords, Sudoku, reading, learning a new language or musical instrument. Social interaction also counts. Talk to friends and family often. A 10-year study published in the Lancet found that mentally active seniors had 30% less cognitive decline. 5. Manage your heart health. What's good for the heart is good for the brain. Control blood pressure, sugar, and cholesterol. Exercise, healthy diet, and medications if prescribed are key. According to the American Heart Association, keeping your blood pressure below 120/80ths mmHg can cut dementia risk by 25%. Dementia is not a normal part of aging, and the choices you make today can shape your future brain health. Start small. Walk more. Eat better. Sleep well. And stay connected. If you found this video helpful, please like, subscribe to Healthy Aging TV, and share it with someone who might benefit.